Glad to have you back. Let's start our first discussion. The National Association of Resident Doctors downed tools on Monday in various hospitals after an 8-hour meeting which ended in the early hours of the morning.
Now, that decision to go on strike comes despite a meeting last week with Labour Minister Chris Ngige and Health Minister Professor Isaac Adewale, where government made offers so that they shelved the strike. Now, the Doctors Association wants an immediate payment of salary shortfalls experienced between January and May this year. They
also are asking the government to stop its plan to stall the promotion of resident doctors. With us in the studio is Dr. Joseph Onigbinde. He is an infectious disease specialist. Good morning to you, Doctor.
Good morning. How are you?
All right. We'll also be joined on the phone to discuss this by the Secretary of the National Association of Resident Doctors, Dr. Anneke Emmanuel. Good morning and thanks for joining us. All right. Before we get to NAD, that's the Association of Resident Doctors demands and all of that, what do you think about the strike now being embarked upon by the National Association of Resident Doctors, in spite of the fact that they had entered into some kind of a memorandum of terms of agreement with the government? Well,
it is unfortunate that this has to be, but I want us to know that Nigeria, it appears as if the only language you understand is that of strike, and that shouldn't be, especially when it comes to healthcare. It is unfortunate, but again, I will not say we have to. I'm not here to speak for the doctors, but I want you to know that what they are demanding for is actually legitimate. You know, the Bible says that do not muzzle the ox that treads the corn. Okay. So I think they deserve their salaries. So I can't even imagine working for 2 months not being paid. They also have responsibilities. They have children they have to take care of.
But this is not the first time they would be embarking on such strike actions, and the ones in the past yielded little or no result. So why go the same way again?
I think, well, what do you want them to do? To say, okay, we'll continue. Can you do it? We continue to work without salaries because we've always been arguing and you are not paying us. So it's better they even resign and say, okay, let's go and look for some work somewhere else. The other time you asked me that why is it that we have doctors all over the world that are very, very skillful, but they don't want to work in Nigeria because salaries are not paid. That's not the only reason. Not only salaries, but the enabling environment is not there. That's the problem with our system. And I think we should not just lay the blame at the doorstep of the doctors only. I think our government should look into it seriously.
All right. We have Dr. Anneke Emmanuel of the Association of Resident Doctors. Good morning once again. Thanks for joining us.
Good morning.
Yes, indeed. There are concerns that yet again this strike by doctors may just lead to the death of so many Nigerians who need, urgent healthcare. You've accused government of not showing enough commitment with its agreement in the past. And of course, you took this step after signing the memorandum of terms with the government. Tell us more about that. Why exactly have you decided to, make this U-turn?
It's not an accusation. Actually, we started negotiation with government since 2010. And since then, we've had series of meetings, uncountable meetings. And each time we signed MOUs, each time we reached agreements, but none of them have been honored. Now, we signed another agreement. We are not down to boycott engagement. They called us to engagement, which we attended. We negotiated with them, we reached some agreements. But we brought it back to our members, which is the supreme body of the association. They said that we can't continue taking agreements from government. We need palpable evidences. That was why they proceeded on the strike.
But then what happens to Hippocratic oath of the doctors?
We are all aware of those Hippocratic oaths. We all have relatives that are also going to be patients one day. We also might be patients one day. But the government pushed us to where we are now. We have reached our elastic limit. Since 2010, we have been enduring. Throughout this year, we have been on percentage salaries. Some people got salaries as low as 28% of up their salaries. Some state institutions, we are being owed up to 2 years' salary, 24 months. They've not been paid. Our members in FMC Owerri, they were owed salary of December 2015 for offense they did not commit. Other people were on strike. The hospital was locked up. We pleaded with the minister. He said he wasn't going to pay them.
Well, the president of NARD, the Resident Doctors Association, John Onyebuchi, says that NARD rejected the promissory offer from government until all the requests are met. How realistic is it that government at this time of recession and at a time when government is still battling with ASU to, for lecturers to go back to the classroom, how realistic is it that government can actually meet all your demands for you to go back to, attend to patients?
It's very, very practical. The thing is not all our demands. These ones are the ones we presented to them. We have avalanche of demands that we have presented to the government. But out of those plenty demands we brought out 6 that can be done immediately so that our members can go back to work and the masses will be happy.
All right, but the impression many Nigerians got during the meeting with the representatives of the federal government was that some form of agreement was reached before the signing of the MOU. Even the engagement of parity between the COMMES and even CONHES. But now with this latest development, and of course knowing that doctors in the past went on so many strike actions that yielded little or no result, how positive are you that this one is going to be a game changer?
The issue is that it's a matter of trust. We have had previous agreements with government which them didn't honor. So the trust, there has been betrayal of trust. Our members felt we can't trust them anymore with these promises again, because if these promises continue, by this time next year, we'll still come back to the drawing table and get another promise from them.
All right, Dr. Onigbide, he's saying they've lost all trust in government. Where do we go from here when the doctors don't trust the government, that government can actually commit to whatever it has, signed up to meet? This is
disheartening. Like I said, they have been at it for, like he said, 7 years. Yes. That is too long, and I think their demands are just basic and fundamental. They may not meet all the demands, but the basic thing is salaries. I mean, I can't imagine me going to work with children and my wife at home and not being paid salaries for months. How does the government expect the people to be committed? When you now say you get to a clinic and you don't see the doctor has gone to do private practice because he has to make ends meet. So I think we have to talk to the government. The government has to be alive to their responsibilities. Said we're in period of recession, agreed. But in the period of recession, we still have millions and billions being snatched out of the country. You see, this thing has to go round. It's not just once. Politics is now becoming a career, which should be a calling, but it's not a career. And #1 career in Nigeria, which is unfortunate. We are neglecting the basic thing, the most important things, the educational system, the health care system, which should be the paramount something in the country, are just being relegated to the background. They can't get development in such an environment. So I think we all have to call a spade and tell the government to be alive to its responsibilities.
All right, Dr. Emmanuel, now would you blame the federal government wholly for the problem resident doctors are facing? What about state governments, their own responsibilities to resident doctors?
I'll blame the government, both federal and state, for this present problem we found ourselves in.
Why is that?
I think we have endured enough. Every human being knows that we have endured enough.
All right. Well, it really is one that leaves you almost speechless. You don't even know where to go from here. But really, what is the permanent solution? We need a way forward. What is the lasting solution to the issues that cause this industrial action, especially in Nigeria's health sector?
We are all Nigerians. We are foreigners. There are international best practices everywhere. Let us borrow a leaf from them. If you want to owe salaries, owe it to everybody in the country. if you want to pay salaries. These things are basic requirements, are basic amenities. We are not demanding for them to give us private jets. We worked for this money. We are demanding for our salaries.
All right.
Basic requirements.
Okay. Dr. Onigwede, let me come to you. Apart from the issue of salary, because it seems the loudest really of the demands, but then some other issues, very germane, is that the doctors are complaining about government not sponsoring their training. Yeah. And of course, we know that medical practice is very, very key in any society. So how important should the federal government, and of course, state governments now treat training and retraining of doctors?
Yeah. I think it's right and it's crucial. Until you get out of this system, your education is not complete. You know, if exposure matters, especially in medicine that is evolving every day, there are new innovations. So, training and retraining is very, very crucial, and it should be seen as part of the things that are responsible of the government. So it's not just salaries. Like I mentioned, it's just not only salary, but enabling environment. Training and part of training is part of the enabling environment. You have to know what goes on in this place. This was the latest development in the field of medicine. You can't get that in this own environment. So I think government has to, to stand up to that. Training and retraining very important, and also our stores are almost. I mean, you get to some hospitals, you don't have drugs. You don't have water. The other time I went to Luth, I was shocked. I said for 2 weeks, no more operations. They said they have suspended the operation. Why? Because there was no diesel. I never had that before. There was no diesel. They have to ask the relations of patients to go and look for diesel. No water. This is sad.
Of course, not too long ago, doctors at Luth actually went on strike because of inadequate facility and very poor conditions of work. Now, speaking of training, Dr. Emmanuel, we do hear that some kind of blueprint is being worked out for postgraduate training of doctors in the country. What is the situation with that?
I beg your pardon.
A blueprint for the training of postgraduate doctors in the offing, according to government. What can you tell us about that?
We are working on it so that we have it legislated, so that we have a template that every other institution will follow, because that has also been a source of agitation for our members. You have different templates being followed by different institutions, and some people are also being victimized because of it. If your chief executive doesn't like you, he will not follow the laid down rules, and you might be ejected from the system. But now, with the blueprint that we are working on, when it comes out and it's signed into law, that will help solve almost 80% of our problems.
Okay, now the Office of the Accountant General of the Federation, we hear, has started the process of paying the shortfall of salaries owed in batches to doctors. And of course, those not captured would be done soon enough, really. So one would have wondered that after the pre-strike, doctors would have engaged the government in more dialogue instead of kind of cutting off the finger to spite the nose to spite the face.
Hello? Hello?
Okay. That the Office of the Accountant General, we hear, according to information we got, started the process of paying the shortfall of salaries owed in batches. So why didn't resident doctors engage in more dialogue instead of going on full strike?
Actually, that's what we hear. But in one of the visits to their office, because we've actually been doing even what is not part of our job jurisdiction, we went to their office and they said that they have paid some of our members. There and then, we called them on the phone and it was all lies.
Wow.
Now, they also say that they started paying in batches until we get the alert and we see the money. We will not believe. Talking about the knee-jerk approach, this thing is something we started. When we first had the shortfall this year in January, we wrote to all the relevant authorities, even Ministry of Finance, DSS, Ministry of Health, Ministry of Law, wrote to everybody. We did all we were supposed to do to avert this thing, and we are telling them, we are warning them off hand.
All right, Dr. Aneke Emmanuel of the National Association of Resident Doctors, thank you so much for your time this morning, and we do hope the next time we speak, you would have gone back.
Thank you, man. The pleasure is mine.
Wish you the very best. Dr. Onigwede. I wonder what you have to say about, what he just said. They're still waiting for the alert. Of course, some tertiary health institutions, we are told, have started receiving payments in batches. Well, he's saying that's what we've heard.
No,
we've not received any alerts.
That's always a problem. All this, I think, is just political propaganda. We are doing this, we are doing that. We never see these things, never see the light of the day. I think we have to cry out to our government to be serious about this thing. Health is very, very crucial. And I keep on saying it, that in this nation, we have relegated the issue of health to the background, which is not good.
Yeah, under 6%.
And it's because our leaders themselves, our leaders, when they are sick, they have the means to go out of this country. It is a shame. It's a shame you have such a big nation with such resources, and yet you can't produce one internationally recognized hospital where you can even treat yourself. It's a shame.
Yes,
and
indeed. And somebody said
at this time.
Pardon?
That the government should treat it as an emergency.
Oh, yes,
this time
absolutely,
around,
absolutely.
Well, 70% of black doctors in the United States are actually Nigerian.
Oh, yes.
Nigerians. That really is mind-boggling. Speaking of the budget for health in 2017 appropriation, what exactly do you think would be the realistic thing? Of course, there's the Abuja Declaration of 2001 that puts it at 15% of the national budget. Laughable.
Okay. Is that what we have right now?
Unfortunately. No.
What we have right now is below 5%. And that is the benchmark. That's the minimum, basic minimum for what do you call it, budget of health of any nation. Minimum should be 5%. And it's a long time we had even 5%. The last time we had...
minimum 5% or 15%?
5%. What we have now is less than 5%. As I speak, it's less than 5%. That is very sad. I don't know what you want to do with that.
Wow, thank you very much, Dr. Joseph Onigbide. You are an infectious disease control specialist.
Thank you
for
very
coming
much.
to the studio.
God bless you.